Good morning, everyone, and welcome to Live with Mel. This episode is brought to you by Yellow Cab Company of DC. If you're looking to avoid rideshare prices, then check out the Yellow Cab Company of DC when you are in the nation's capital. This nation is facing an epidemic when it comes to overdose and drug abuse. In the past several years, we have seen the rates of opioid addiction and the rates of overdose increase exponentially. This past year, 2021, was a year where we saw over 100,000 overdoses happening, increasing the amount of overdoses that happen in this country. Now, the Biden administration has been coming up with plans to deal with the rising opioid addiction and other drug-related addictions as well. Now, for the past several decades, the plan has been the war on drugs, but we have seen that the war on drugs has been ineffective. It has not helped. Many Americans are still trying hard drugs and getting addicted to hard drugs. And it looks as though the Biden administration wants to focus on prevention and helping rather than punishment. Now, with the war on drugs, we saw that when people did become addicted to drugs, essentially they were punished for it. So jail time, going to court, going to prison when they have been addicted to drugs. Now, other countries across the globe as well have other policies in place to help deal with drug addiction and overdoses that does not necessarily lead to punishment, but rather it leads to help. It leads to people getting help, whether it's through therapy or other programs. Now, last year, back in December of 2021, the Substance Abuse and Mental Health Services Administration announced an unprecedented $30 million grant to help people who were going through addiction. So essentially, that grant would go to nonprofits that try to help people who are addicted to drugs. Now, again, this is a very different policy than the war on drugs. It does not focus, this $30 million grant does not focus on arresting and putting people in jail and prison, but instead it helps people in various ways. Now, while this program was announced back in 2021, so this around December 8th is when the press release was released by the Biden administration, it has been making waves this week because it was a deadline for them to apply for the grant. And I think sometime around May, we'll start seeing the bulk of the money being doled out to the various programs. Now, the reason why it has been controversial, the reason why people have been talking about this program is because of the type of help this money would go to fund. Now, again, with overdose reaching over 100,000 people in the United States, we realize that this is not the way to essentially deal with people who are addicted, that the way that we're doing before the war on drugs isn't helping. So the Biden administration is trying a different approach. Now, the grant would do several things. It would provide money for distributing overdose reversal medicine, so Narcan and other medication that could stop people from overdosing. So it would give that out. Another thing that the program, that the grant would fund, is fentanyl test strips. As we've seen, overdoses have increased, especially amongst opioid users, especially amongst heroin users, because many dealers have been lacing their heroin with fentanyl. So we're seeing a lot of fentanyl overdoses because people are injecting themselves, they're consuming these drugs that are laced with fentanyl, which a very tiny amount can kill you. Now, it's also going to provide overdose education and counseling. I think one of the big things there is counseling as well. So instead of treating people who are addicted to drugs as criminals, they're going to provide them with counseling to help them recover from being an addict. And again, counseling can be a very powerful thing. Now, the controversy arises with the next group of programs that the grant actually funds. Now, they're going to expand because remember, this service is already in place. The money would also be used to expand syringe service programs. Now, the reason why they expand these programs and they have these programs in place in the first place is because it stops the spread of disease. Now, again, when people are addicted, they don't necessarily think about the consequences of things. And when they have these needles, they'll share these needles with each other, which then, again, pushes the spread of HIV and hepatitis C. Now, they're looking for nonprofits who will be able to do these things. And they have found several nonprofits that will be getting the money. Now, something that has caused a lot of controversy is the safe smoke kits. Now, the safe smoke kits essentially is programs, nonprofits providing addicts, specifically crack addicts and other addicts that use pipes with pipes and other things to safely, and again, I say safely, but again, drugs are not safe, but to safely consume the drug. And one of the biggest reasons for that is many people, again, who are addicted, not think about consequences. And a lot of times the glass pipes that they use they're broken, they contain cracks, and they end up sharing these pipes and essentially spreading more and more diseases. So now there are programs that have these safe smoke kits in place. Now, something else, again, there's a lot of controversy surrounding this program because it's very different. And a lot of people believe that the programs like these do not help, but they have had good track records because they allow people to not put themselves in further danger. Again, when it comes to addiction, people do not think about the consequences because drugs like heroin, drugs like crack, drugs where you are physically addicted to something, the only thing that's on an addict's mind is finding their next fix. And they don't think about the consequences. They don't think about the diseases. Now, something else that this could possibly fund as well are safe sites for people to inject heroin and any other injectable drugs. Now, again, safe sites have been tried in the United States. The first official authorized safe space opened in New York City in November, which essentially provides a safe place where addicts can go in and inject themselves with the drug. Now, why is this relevant? Why would there be government funding for this? Again, many people do believe that it's encouraging drug users. However, it does also keep the general public safe. Now, the Biden administration is not trying to increase drug users. It's not trying to encourage drug users, but they know that when you deal with addiction, the only thing on your mind when you're going through withdrawals is getting that next fix. And putting these safe places keeps the general population safe, and it keeps the addicts safe as well. And I'll explain how it does that. Now, when you have a safe place, you have people who are providing you with the needle exchange program, which means you're using a fresh needle, which means you won't contract HIV and you won't contract hepatitis C, which means you don't clog up the emergency room systems, you don't clog up the hospitals. Which again, at this time, we need to keep the hospitals clear because we are still in a global pandemic. The next thing is many major cities are seeing needles everywhere. They are seeing needles on the street. If you go to San Francisco, you can see people injecting. When I was in San Francisco last time and I was walking down the street, I literally saw a man throwing down his pants and shooting up right in front of me. And it wasn't like I was in a bad part of town. It was just that's where he decided that he was going to shoot up. We have addicts that are shooting up in broad daylight in front of people because all they can focus on is their next fix. So it stops the needles from hitting the ground. And again, that keeps the general public safe because if there's needles on the grounds, kids can pick it up. Kids can go through overdose because if there's still heroin and fentanyl on the needle and a kid touches it, they could go through an overdose. If police officers are dealing with something, they could accidentally be stuck by the needle. And then they are then introduced to things like HIV and hepatitis C. So again, these programs aren't being put in place to essentially help drug addicts stay drug addicts, but it's keeping people safe on both sides of the line. It's keeping people safe who are addicts because they're less likely to contract diseases, and it's also keeping the general public safe as well. Now, again, at the end of the day, counseling, substance abuse programs that really focus on getting people off of the drugs are also going to be funded as well. But we can't lie to ourselves and say that what happened before, the programs that were happening before, they weren't working. The war on drug wasn't working. No matter how much money was pumped into the war of drugs, we kept seeing more and more and more addicts. And because of that, we keep seeing more emergency lines being tied up, more first responders being tied up because they have to deal with the ever increasing overdose. Again, in many communities, they're getting calls for overdoses every single day. In many communities, they're dealing with overdoses every single day. And it's not just the addicts as well. With the rise of drug dealers lacing drugs with fentanyl, we're seeing that officers are suffering from overdoses because they're coming in contact with fentanyl. Just a tiny amount, smaller than a dime, can kill an officer if they come in contact with it. So again, safe spaces allow everyone to be safe. But let's go ahead and go with the comments because I know this is a very, very controversial topic. So Joanna says, I'm not into giving syringes or pipes. I do not see how that can help, but I do believe in the program to help with drug addiction problems. So again, it is controversial and it has worked in other countries as well, but it is something that Americans are not used to. At first glance, it really does look as though by giving addicts safe smoke kits, such as crack pipes and heroin needles, that the administration is trying to encourage drug users to continue to be drug users. And that's further from the truth. Safe spaces help because they keep addicts in one place. If you know there's a safe place, if you are an addict and you know there's a safe place where no one will bother you, you're more likely to go there. These safe places will be filled with overdose reducing drugs. So if someone does go through an overdose, the staff at safe places will be able to administer them so cops aren't rushing out, so paramedics aren't rushing out. They'll have the ability to stop the overdose right then and right there, which will stop a lot of deaths from happening. At safe places, where again, they could possibly provide you with needles and pipes as well, at these safe places, there's also counselors there to help people. So if you continuously go to a safe place to consume the drug, essentially you'll have counselors there. So when you are ready to come off, you have a direct line to someone to speak to. Even places where they have the needle exchange program, there are counselors there as well. So you have the ability to seek help if you're looking to seek help. Now, when it comes to addiction in the United States, most people are pretty much concerned with punishment because that is essentially what we've been taught, what this country has done for decades. But it's not working. It's not effective. And since it is not effective, since we've been fighting the war on drugs for decades and losing, the Biden administration is trying to find another way to deal with the ever increasing addiction issues. It's not working. The war on drugs is not working. And no matter how many people you continuously arrest, they're still going to be addicts because they're facing punishment. And at the end of the day, when you have an addict who's arrested and sent to prison because they're an addict, they're in jail, they're still able to get drugs in jail because it's very easy to get drugs in jail, including heroin, including crack. You can get it. You can use drugs in jail. Then you come out, you have a record, so it's hard for you to find a job. So you're in a depressed space, which essentially means that you're going to fall right back into the cycle of abusing drugs because you think you have nothing going for your life because you have a record, you can't find a job, and everything's going wrong. So it becomes an endless cycle. If you break the cycle somewhere along the lines, it's easier for people to find help and to shake their addiction. And then let's go to the comments. So Joanna says, exactly, instead invest in safe places fund rehabilitation centers. And again, that is part of the program. Again, the first safe space was really opened in New York this past November, and safe spaces do work because you keep the problem contained. Instead of heroin addicts shooting up on the street, leaving needles on the ground for kids, police, anyone walking by to find it, which possibly can lead to them overdosing or could also lead to them contracting HIV or hepatitis C, safe spaces work because it keeps the problem contained. It provides counseling for people if they want it, and there's less likely of overdose deaths because they have the reversal drugs available. So again, they do work, but it is controversial, and it's controversial because it hasn't been done in the States before. Now, it looks as though San Francisco and I believe Seattle, they're looking to try safe spaces as well. But within these safe places, they're still going to have the safe smoke kits, and they're still going to have the needle exchange programs because, again, it keeps people safe. Counseling is what many of these people need, but many people who are addicts are not ready for counseling. But when you keep going to safe spaces, the counseling is available for when you need it and when you want it. So again, this is a huge, huge issue. And the previous way that we were dealing it is not working. So the Biden administration is providing these grants in order to try a different approach. Punishment doesn't work with addicts. They do need to face the consequences of being an addict, but punishment is not where they need to go. They need to go to treatment centers. They need to be seen as humans who are, again, suffering from an illness. Many people believe that addiction is an illness, and dealing with an illness by punishing people and sending them to jail is not effective. It may work for some people, but it's very few people that it works for. The war on drugs has caused a bigger issue than helped. We're seeing many, many jails being overpopulated with addicts who are, again, being punished instead of being helped. Instead of going to jail, they need to go to counseling. They need to go to treatment centers. They need people who see them as human, who are on their side as well. And when we look at the current opioid epidemic that we're seeing in the United States, we know it was essentially caused by doctors who are overprescribing painkillers, by pharmaceutical companies who initially said that these opioid drugs that they were giving to people were not addictive. This was manufactured by companies, by doctors, by the medical professionals in the United States. These are not people running out looking to score, but rather these are people who were overcoming surgery, who had chronic pain, who then became addicts because they were told something that they were given was safe and it was not addictive and they couldn't get addicted to it. And now these same people are living in the street looking for their next score. Addiction is a big issue. The war on drugs doesn't work. It's time for the United States to find another way to deal with the growing issue because it's not going away. Counseling, safe spaces, needle exchange programs, safe pipe kits, these all help. And it not only helps addicts come to terms with the fact that they're addicts and provide them with a safe space, it also stops the spread of disease. Because if you contract HIV, it's no longer a death sentence. However, it's a lifelong issue that you have to deal with which you need a lot of medication to actually deal with it, and expensive medication at that. Well, let's go ahead and go to the next comment. Let's go ahead and pull up that next comment. So let's see. Joanna says, 100% of Americans focus on punishment instead of rehabilitation. That's why we have addiction problems that will never go away. And I do have to agree with Joanna there. Punishment doesn't help. It does not help. Joanna also says, maybe if we invest in education in families in our communities, maybe we would not have these issues. Now, again, investing in education is part of the $30 million grant. They are investing in education for addicts. But again, education is something that Americans struggle with anyway. Educating people about addiction would be, it's a hard thing. We have a lot of programs like DARE that doesn't work either. Because a lot of times, programs like DARE will lie to kids and make things seem worse than they are. And I'll give you an example. The whole campaign by DARE and other programs where they were against marijuana didn't work because these programs told kids if they smoked weed, terrible, terrible things would happen. And then they smoked weed and nothing terrible would happen. So then they didn't believe the rest of the education program and they were okay trying other things. I think the way that Americans deal with drugs is the wrong approach. We tried this for decades. We've had DARE. We've had the war on drugs. It's not working. It's time to try another approach. And while I think these programs look promising, while I think focusing on rehabilitation and providing safe space could work, it could or it could not. We have to wait and see. But again, at this moment, what we've been doing for the past several decades is not working, and it is time to try something new. So we'll wait and see if this trying something new actually does work. So guys, thank you so much for tuning in. My name is Mel. I come live every single Wednesday, to bring you guys current events and let you know what's happening across the country and right here in this great nation as well. Thank you guys so much for tuning in, whether you're watching the live stream or whether you're watching this on our TV station, ENSL TV. Thank you guys for watching. I will see everyone next week. Have a great week and a great weekend, and stay safe, everyone. Again, my name is Mel, and I will see everyone next week.